Good afternoon. I am Shannon Miller with the Miller Elder Law Firm. I have the pleasure of seeing my dear friend and colleague, Dr. Mandy Roscow, who's going to talk to us today about pelvic health and all things pelvic. And she and I had a good chat yesterday to try and figure out, like, what should we focus on? And we got into a little discussion ourselves about everything related to pelvic health. And Mandy is a PT. She's got her doctorate in PT, women's health PT to be exact. And she does a lot of coaching for women to strengthen. Well, I'm going to let you tell what you do, Mandy. You know, I know firsthand that Mandy does excellent work, and I will let her explain a little bit more about her background, training, and what she does. Mandy?
Okay. Thank you, Shannon. Yes, I am a physical therapist and I have been specializing in pelvic health for over 20 years. And so I've been doing it a long time. And practice has evolved and changed a little bit for me in the last year or so. I've been doing some more training on women's health coaching and some other things as well, but I still have a focus on pelvic health. And I'm excited to be here today because I think there's a lot of stigma and embarrassment around some of these issues that are so common with so many people, but we don't want to talk about them because people don't want other people to know they're peeing their pants or they're having any issues with sexual function or any of the things that typically my patients are having are really private but also like so core to their quality of life that I think the more we can talk about these things and make it normal that so many people experience it and there's solutions for it, I think the better that it can be for our health and wellness.
And, I there's two things that I hope we really get to today. And the first one is this tendency to be disconnected from our bodies. And I think our pelvis in particular, just I know as a yoga instructor, like explaining to people how to grow tall and like kind of really raise up your pelvic floor. It's sometimes initially you can see people a little uncomfortable with this idea of engaging your pelvic floor. Like you wouldn't be uncomfortable if I said engage your bicep, but for some reason there's this like societal disconnect from engagement from an interoception or thinking about the inside of your body related to your pelvic floor. And I think we talk a lot about women's health, but men also have a pelvic floor. And it's important for them as well. And so that's number one. I want to talk about why it is that we seem to have this strange non-attachment to our pelvic floor. And then secondly, I really want to talk about people in their 50s, 60s, 70s, 80s, 90s, hundreds, who are starting to struggle with a weak pelvic floor and the true what can we do at those stages. And I know for a lot of us that pain can even further disconnect people from their pelvic floor. So okay, those two in particular, Mandy.
Okay, so I think I will get to some of that, but if I don't cover some of that and I need to come back to it,
Yeah.
we can always do that with follow-up questions because I want to go over a few myths first or kind of misconceptions that are common out
Excellent.
there, and and then we can delve into some of that. I agree. It is because I've worked with people. It is really hard for people to connect into the pelvic region. And I think there are multiple logical reasons for that. I think, first of all, when you're an outside, whether you're a yoga instructor or it's me as a therapist, it's such a private area that it's kind of odd for someone to tell you, if it's not your partner, it's kind of weird for someone to be, or your doctor. But even then, like that's a little stressful for people a lot of times, right? So I think we have the tendency when we're not, with a partner where you're intimate to kind of almost like shut down because it's like, okay, that's only for like intimate times and I just don't need to think about that area. And then of course a lot of people I work with have chronic pain and pelvic pain as well. And so when there's any pain in that area, what do we do to cope? It's like you're trying to disconnect from what's going on pain wise. So then to be able to connect into it, to feel what your muscles are doing and what's going on, it's very difficult for people because they've done that almost as a coping tool, if
Yeah.
that makes sense. And yes, guys, men and women as well. I'm going to mention that a little bit later, but I mean, women in particularly, I think there's so many things that go on in our bodies from menstrual cycles, ovulation, pregnancy, postpartum, perimenopause, menopause, and so many changes that happen in our system. But we just kind of like you deal with it and you kind of almost try to ignore it. And so I think some of it comes from like training ourselves to kind of not pay attention to that area of the body, that we become disconnected. And maybe even there is some shame around that, I think, sometimes, of like, if that makes sense,
Yeah.
like there are just some interesting cultural things out there that I think affect it. Um and anyway, we could probably talk all day about that. The other interesting thing I just wanted to say is so much of our emotion is tied into what's going on with our pelvic floor. And so they did a really interesting study a number of years ago where they had a group of people watch funny movies, and then they had a group of people watch scary movies. And these were not people with pelvic floor dysfunction, just people, normal people. No one reporting it. I'm not saying they didn't have any pelvic issues, but the group that watched the scary movies had much higher pelvic floor activation because the fact that they were under fear, they activated their pelvic floor as a fear response. Even just watching a movie, it wasn't like they were being chased by this person in real life, right? But even just the thought of something scary causes us to have tension there. But it doesn't mean we're consciously aware of it. Whereas, like the group watching a funny movie didn't have that increase in pelvic floor tension. So I think there's a lot to that, and it definitely is a lot of what I have to do when I work one on one with someone is get them to tune into that, because most of the time people don't really know what's going on. Their idea of what's going on is usually not exactly correct.
And
Um,
and it's interesting because from like the yoga perspective, right? It's like you have these chakras and that's your sacral chakra. And so we hold all of this, kind of things that are unresolved in our sacrum, and that's where we sometimes see it exhibited as pain in your hip or, like, and so it's very interesting that you see the same thing in your practice.
yeah. So if you don't mind, I'm going to start with
Yeah.
some of those myths. Let me share just a minute. Hold on just a second. Can you see that, Shannon?
Yep.
Okay. All right. So the first myth I wanted to talk about is pelvic floor issues occur only in women who have given birth. And even for people who've had babies, people think that only people who have vaginal natural or regular deliveries versus a cesarean section are the people who have problems. And this is not true. Certainly, we have to recognize that the number of births someone has, the size of the baby, certain things about how birth goes does like probably predispose people to pelvic floor issues with aging. But that's not the only reason. And even people who've had cesarean certainly do. I've seen plenty of women who've had cesarean sections who still have pelvic floor issues. I mean, for one, they did carry baby for approximately 40 weeks, and that has an effect on the pelvis. So And then, of course, we're going to get to a little later on, but it's not just women either who have issues. Okay, second myth, urinary incontinence, which is a very common problem I see, is a normal part of aging, and there's nothing you could do about it other than surgery. I like to really say that urinary incontinence is very common, but not necessarily normal. It's kind of our like warning sign that there is something in your system between your bladder and your pelvic floor that's not working the way that it's supposed to. And so it is a super common problem, but it's not, well, I think we have this idea that um, as you age, this is something you have to put up with, and it's just something that happens. And oh, well, you just got to deal with it. Go put a pad on, or go start wearing Depends and go about your life and just don't worry about it. Or there's also that thought, well, if you have a bladder problem, you probably just need to go have surgery. Um, there is certainly a place for surgical intervention. I'm not anti surgery by any means. That helps a lot of people with incontinence. But there are a lot of things that we can do from the pelvic health, physical therapy side of things, and people can do on their own, strengthening and activity wise, to try to deal with a urinary incontinence issue. So that's not true that it's just something you got to put up with.
And
Um,
on that same issue, Mandy, the, if you sneeze and you have leakage, is that normal, or is that something that could potentially need to be addressed?
okay, great question. And that actually my next slide like kind of perfectly lines up with that. So I think you can see here that first picture, that the type of leakage you're asking me about with sneezing is stress incontinence, because there's different types of incontinence and some people have all of them. But usually you have, I mean, a lot of people can have stress and urge. So stress incontinence is when there's some quick change in pressure. So it could be a cough, sneeze, um, anything like that. Could be picking something up under load, like picking up a heavy bag of dog food or something like that. Anything that causes like a quick pressure change. What should happen, and I don't know if you can see my pointer, but right here is showing where your pelvic floor is. Can you see that?
Yeah.
Okay. So when you have a quick pressure, so pressure is kind of coming down on your bladder, because when you cough or sneeze, your diaphragm's coming down, and then you have this pressure of your abdomen pushing on the bladder. What should ideally occur is that our muscles here that surround the urethra, this is your bladder, and then this is the urethra that you pee out of. This actual, just to be anatomically correct, this is actually a man, because this is the prostate here. So this picture is actually male bladder. Women would not have a prostate. Um, so what should happen is we have muscle, the layer of muscle here surrounding that sphincter, that when that pressure comes, it should quickly kind of close off to, kink the hose, so to speak, of your urethra. Because we can have a little bit of urine sitting in our bladder. That's very normal, right? So what that process is supposed to do is kind of hold as the pressure comes down. So literally what's happening when people have stress incontinence is that your pressure from your squeeze of your muscles is not as strong as the pressure coming down, because it's too weak. And honestly, we're not going to get into the complicating factors with that today, just with our time constraints, because I've been to, entire class, could talk for hours and hours about the ins and outs of stress incontinence, but that's the basics of what's not happening. So it is extremely common, and it's not that anything's wrong with someone because they're having stress incontinence, but there's something in this system that's not working well. So it could be weakness of the pelvic floor, could be other parts of your core coordination where you have weakness just generally. There can be a variety of things. And there's also like for some reason, the coordination of our brain to the pelvic floor and what it's supposed to do is not working as well. So there can be even a neurological component as well. The second type of incontinence, just so while we're here, is urge incontinence. So this is where you get the urge to pee, but you're not at a bathroom and you need to hold it. So a lot of people that have urge leakage, they might even be walking to the bathroom, but they end up peeing before they're like sitting down on the toilet. If you're a lady, or guys standing at the toilet, they end up having a lot of leakage, and it could be walking to the bathroom, it could be in the car when you get home. Your body associates, I'm home, I need to pee. And the bladder, there's a muscle around the bladder itself. Here's my little bladder. There's a muscle around the bladder that actually can squeeze. When we go to the bathroom, that does this normally, it squeezes to push the urine out. So what can happen with urge incontinence is this bladder muscle is squeezing and pushes the urine out without there being a contraction of the pelvic floor to hold it in. So the mechanism of like urge incontinence, or sometimes people call this overactive bladder, that's very different than stress incontinence. Like what's causing that? Sometimes this can be habitual patterning of people peeing too often. And so then if they have to hold it, there's a variety of things that can cause urge incontinence. But just to show you I'm giving you the basics here, really.
Mandy, one of the things that we do see a lot of as people age is that they drink more coffee. Does this add to the problem at all?
Sure, definitely. One thing I usually have people do when I see them is fill out like a bladder log, and that includes like, what are you drinking and eating? Because sure, I think we've all had, even if you have normally, you have good bladder control. If you have too much caffeine, alcohol, even carbonated drinks, the LaCroix and the waters, the different waters that are gas, water, Perrier, all those, even the carbonation can actually irritate our bladder. So there's definitely a lot of different things can cause more stimulation, more urgency. But yes, definitely, like urge incontinence, a lot of times we have to look at what are people drinking, and what effect does that have on the bladder. Could also increase stress incontinence, just because your bladder may be more stimulated from the caffeine, or from the carbonation of a drink you're drinking. The other thing that's popular with the younger crowd are these energy drinks. Those are very stimulatory to the bladder. So yes, what you're eating, even what you're eating, some people will have more reactive bladder if they're eating spicy foods, for example. So there is definitely a component of bladder control and incontinence that could be related to, like, drinking too much caffeine. And so sometimes we have to work one-on-one with the person. How bad is their leakage? What are they willing to do? It may not be that you have to give up coffee forever. Just maybe while you're working with someone one-on-one, someone like me, like a therapist, and you're getting stronger, you might need to really cut back on the amount, or maybe go to half calf or decaf, rather than drinking full-blown caffeinated coffee for a period of time to decrease the leakage. Does that help?
Yeah.
Okay. Overflow, this is not as common, but this is where in men, if the prostate is enlarged, it can actually push down on the urethra and cause some leakage to come out. And then the neurogenic bladder is not as common as well as the first two. But if someone has any kind of neurological injury, so that could be spinal cord, could be even something like multiple sclerosis, Parkinson's, like any neurological condition, can have some neurogenic bladder issues, which are a little more complicated, because that has to do with what's not working right from our brain through our spinal cord to the nerves that feed our bladder in order to have bladder control. So that's a little bit different in that category over there. Okay, myth number 3. Once you're a certain age, you're too old for pelvic health physical therapy. Or the other one I hear this along the same idea is you can't increase the strength of the pelvic floor as an elderly person. And I would say that's absolutely not true. I think the younger we can get people, if they have bladder issues, the better, because then you're going to get control of the problems before you start aging. But I have personally seen people into their 90s. I don't think I've seen anyone over 100. Um, but I have seen people in their 90s, a lot of people in their 70s and 80s, and we can make progress. I mean, it's not, as I think people in that age group will know, you can go to the gym and you can build muscle. Is it going to be as easy at 80 as it would be for a 30-year-old person? Probably not. Takes a little longer. Um, we do know that the little muscles around the sphincter and the urethra lose about 2% of fibers as people age past a certain age per year. So there is that. You're kind of battling up against that, but it doesn't mean there aren't improvements that can be made, that we can't get stronger. We can't change some of these lifestyle things that may be affecting things like diet and what you're drinking. But yes, I would not say, oh, you're too old, it's too late for you to do pelvic PT, is not going to help you at all. As a matter of fact, I would say, no, like any little, even if somebody doesn't eliminate their incontinence, if they have more control, at least a percentage of the time, that's an improvement.
And what about like hormone replacement therapy, like estrogen? Does that help at all with, I know there's this idea about the thinning of the walls and, that estrogen can kind of help build up some additional, I don't know, tissue down there. Am I saying that right?
Yeah, yeah, and that's this next myth I'm going to talk about. We'll talk about that a little bit, not the hormone replacement. I am a big fan personally, and I haven't seen anything research-wise that would deter me otherwise of people doing hormone replacement therapy, because obviously for women in particular, not as much for guys, but once you're menopausal and you don't have the estrogen to the pelvic floor muscles, we know that the pelvic floor muscles can atrophy more. There can be a lot of tightness and like almost like narrowing even of the vaginal canal without estrogen, and weakening of the pelvic floor. That can be part of why, for example, women tend to have a lot of pain with sex as they're getting older. Is it might be decreased lubrication, but it also can be the muscles are actually closing in, getting tighter, but it's not. So the hormone replacement can definitely help with that. Now, I'm certainly, because I don't prescribe the hormones. You'd have to see someone that's, kind of trained in that. But the one thing is, if you've been menopausal for a long period of time, your options for hormone replacement might be a little bit different than someone who's, within 10 years of menopause. Because what happens with time is we actually lose some of our estrogen receptors. And so, what your options are at different ages is different, but you'd have to see somebody that's kind of a specialist in that, because there still are options.
And what is the best age to start thinking about this stuff? Like, I mean, I know you and I have talked about women coming to see you in their mid 40s and, younger. Is it really important to start that brain pelvic floor connection like when you're 18, when you're 14? Like, do you need to start really trying to figure out, like, when am I engaging my pelvic floor and when am I releasing my pelvic floor? Is that something that you should start doing, throughout your life?
Well, yes, honestly, and I've seen even teenagers. So, a lot of people don't know that like college athletes have urinary incontinence issues, especially sports that require a lot of plyometric, like basketball, volleyball players, gymnasts are another ones that have issues. And so I guess I would say if anyone has warning signs, if any bladder young, you get in to get some guidance right away. But I definitely think if in the 20s and 30s and even into the 40s, when women are having babies, is probably a really important time, either during pregnancy or postpartum, to see a pelvic health specialist, because you may not even be aware that you have weakness, because you might not have leakage. You could be weak without leaking at that age. That will catch up with you, as you get older potentially. So really, I think in that women in their 30s and 40s, if we kind of caught them at that age, it might help as they're getting older. And then, of course, the other age group that I would say is very important is perimenopause, and it's pretty soon after the menopause transition, so that you're kind of, as you're going through all those hormone changes, you can kind of connect with your pelvic floor, strengthen and work on that process as the body is starting to shift. And so hopefully you will set yourself up for a better long-term system as you're growing into your older years.
And Mandy, you were the one who told me that, the incontinence is really the number one reason for admissions to nursing home facilities, which I've carried with me. And I realize that is absolutely true. We really do have difficulty when people become incontinent and try and live at home. It's like the transition from the bed to the chair to the bathroom that becomes really challenging. And then if people start to have incontinence, it's like you get a bed sore. Maybe if like I have a client right now who can't feel when she has wet herself. And so like we just have to check her all the time, and it's really, really challenging. So like, that incontinence being related to admissions to long-term care facilities, I think is really important for us to remember. This is really an important way to age in place, is to maintain your continence and maintain the strength of your pelvic floor.
Exactly. I mean, I think most all of us would like to stay in our own home as long as we
Mhm.
can, right? As we're aging. And so it's because families can't manage it unless someone has, very regular nursing care, especially if there's a sensory issue, like you mentioned, because people can start to have bed sores and skin breakdown if they're dealing with wetness there chronically, especially as we get older. Our skin integrity is not as good as when we're younger either. We get more of that paper thinness of our skin. And so the likelihood, if you have urine there, even with a diaper on, I mean, it does absorb, but it's not, there's still wetness against the skin.
Right.
And so yes, for people for longevity, and just even embarrassment and how they feel about themselves. You know, a lot of, no one wants to be in diapers, right? And so I think, I know another aging factor is people being able to have connections and being social, right? And going out and doing things. And there are a lot of people, because there are wetting their pants, that don't want to go do things,
Yep.
right? Because they're worried, what if I have an accident? And by the way, I do sometimes see people have fecal incontinence as well. So, we're talking a lot about bladder because that's more common. But you can imagine if people are having, poop accidents, that's really distressing. And those people really a lot of times don't like leaving the house. I mean, if they do, they sometimes have to take a complete change of clothes with them just in case.
And I know I'm sidetracking you again from myth number 4 and 5, and I'm gonna try and
Good.
maintain this, but I think one of the other things that I've noticed is that in particular women do not know if they're engaging their pelvic floor. So they might be thinking, I'm engaging it right now. I'm good at it. And yet they may not be, or they may be pushing down instead of like that hammock of like raising it up towards the top of your head. And so, I learned that from you as well, that really sometimes when we think we're doing it, or sometimes we think, and I guess it's also with breathing, like, you've taught me that some people will breathe as they breathe in, they might engage, as they breathe out, they might engage. So it varies from person to person as far as how those techniques work. So, it can be kind of an unknown, you don't really know if you have pelvic floor engagement or not.
Right. I mean, I can tell obviously if someone does, but for
Yes.
the person there, I think there's a couple reasons for that. And we're going to talk about a few here, but some of it is because there are different ways our pelvic floor should contract. So if this is my pelvic model, here's your outside pelvic floor and then the deep layer. So in
Can
this,
you stop the screen share while we're looking at that? Because I think
oh,
that's such a great model.
I'm sorry. Okay. So in this pelvic model, here's the outside. So this is the superficial layer. We have a middle layer you can't really see on this model because it's up around the bladder itself. And then this is the deep layer. And so you can see how it sits like a hammock here. And when we contract, there's actually different types of movement with our pelvic floor. So normally when we talk about Kegels or a pelvic floor contraction, we're talking about a concentric or a shortening contraction of the pelvic floor. With that, those muscles should lift up towards your head or towards the ceiling, if you're sitting upright or standing. And then around the openings, like your anus and your vagina, if you have one, there should be some closing and some movement there as those muscles lift up and pull up and in. Think of it a pull up and in. A lot of people think about more squeezing around, like, the back door is the one we are all familiar with squeezing, because sometimes if you get gas or something, you kind of, might tend to squeeze your muscles around your anus so that you don't pass gas. So sometimes people are like squeezing here, but they're not getting that lift, that pull up and in of the deep hammock of the pelvic floor. And in this next myth, what we're going to talk about a little bit is it's not just important, can you lift it, but also can you let it down? And can you push down and out? Because, like, for example, I see a lot of people with chronic constipation, and trouble pooping is a huge issue in our society. And sometimes there's too much tension here and they can't do that motion that with a bowel movement, we kind of more do like a pushing down and out. And so I think the confusion in our bodies is people don't know enough to say, they just feel something moving down there and they don't know, is it lifting, is it not, is it squeezing, is it pushing out? And if they have tension, a lot of tightness, it may be very hard for them to tell because there's so much tension in the system.
Yeah, one of the things that you taught me was, to zip from the back to the front, and that conscious interoceptive, like noting the rear end and then zip to the front. And it really got me like thinking about, my body and like, how does that work in my body? And when I can consciously have identification with the different regions of my pelvic floor, it really helped me to focus on, getting into opening those neural pathways where I'm actually engaging this part of my body that I otherwise don't think about that much.
Yeah, and that's important because, if a person only is having urinary issues and no bowel, contracting back here is good. You're activating the pelvic floor, but you really need ideally that contraction to translate to the front so that you have the bladder control, because your urethra sits up here, right? It's in the front. So we need that contraction to translate all the way up to give us that closure around the urethra. So, for example, things that's been very researched is something called the knack. And the knack is basically teaching people to consciously contract their pelvic floor before they sneeze or cough to try to avoid leaking.
Right.
And if you're not getting that all the way up here and you're just kind of squeezing back here, you're not going to be very successful with preventing urinary leakage, like with sneezing or coughing, for example. So yes, and it's difficult for people to necessarily know that on their own, because like I said, they just feel something's happening with their muscles, so they're doing something, but they might not be doing really what they need to do for, especially for like urinary control. Or they might be squeezing their bottom together, right, like squeezing their glutes and not squeezing their pelvic floor, right, but they think that they're tightening there and they're not. um
Yeah. I mean, I know in yoga, like we're taught, like, lift the arches of your feet and you feel your inner leg line engage, and then you can feel the pelvic floor, like lift up to the sky. But that's like the lifting straight up, as opposed to what you're talking about, which is like moving from the back to the front, which is, a whole different set of thinking for people.
And as you lift from back to front, you're going to have that upward motion because it's shortening this whole hammock, right? So it's just a different way to think about it, but especially for bladder issues, that's important. Let me go over these last two, and then if we have
Okay.
any questions,
Absolutely.
we should have plenty of time for. Um, All right, so the other very common myth is that that as we age, the pelvic floor becomes weak and loose, and that's why we have issues like leakage or pelvic organ prolapse is another really common thing that I see. And I think especially for women, I think we think of like the vagina becomes loose and baggy. It's just kind of this open cavern. That's the description I've heard my patients say. That's not my term. That's literally what I've heard more than one of my
Uh,
patients tell me. And we think, well, that's not good, right? Like we don't want that to happen. And that's true. You don't want to be like super weak and loose, but so many people, especially active people or people who just have a lot of stress and are high strung people, have very tight pelvic floors. I mean, athletic women, including probably a lot of the ladies in your yoga classes, even people who are high level athletes themselves, fitness instructors, Pilates instructors, these people are very fit. It's not that they're, when you look at that person, you think, how would they have any pelvic floor issues? They're in great shape. Well, they've been working so much that these muscles are so like just pulled up, they don't have any ability to relax. And the best analogy that I have come in contact with for me of the pelvic floor and what we really want it to be able to do is like a trampoline, which is why I have that picture here. Think about it this way, because our pelvic floor attaches into our bony pelvis, if our muscles are tight, that means these muscles are very shortened. So it would be like if you were on a trampoline and the springs were pulled super taut so that when you went to jump on it, there'd be like no give because the springs were like, let's say they were old and rusty and like pulled together and they'd had none of that spring or give. And when we don't have that ability, that spring, because it's so pulled up, then you're going to have trouble shortening it to lift it up towards your head because it's already partially pulled up. You don't have much further to go. Does that make sense?
yeah, yeah, it does.
So I think that's where, it's not just about people get loose and weak. Yes, that can happen, but more commonly, honestly, what I see, especially with, women's in their 30s, 40s, and 50s, especially if they're trying to live an active lifestyle, is this tightness. And so we actually
Yeah,
have to work on first, let's let it down.
yeah,
Let's realize what does it mean? Like, are you walking around with like clenching your pelvic floor and you don't even know it? And being able to do this, let it down. And once you can do that, you'll be able to do more the excursion of a Kegel exercise or a pelvic floor contraction. So that's really important.
yeah. I
Okay.
mean, and I think working with you myself, like we worked a lot on the breath and like breathing in for me, which I know is a little opposite than most people. That's when I do my engagement. And when I release is when I release. And, just the breath in and out. And if it's the other way for most people, then that would be breathing in and letting your pelvic floor settle and then breathing out and engaging gently your pelvic floor. That was really helpful to me to understand, to
Yes.
really connect with the actual part of my body through the breath. It was just very effective. It's just something that you don't normally do. It's not like you go to the gym and your trainer's going to teach you that.
Yeah, exactly. They don't even really know. I mean, some of them might if they're, depending, but that actually you did a perfect transition into the next myth, which is that Kegel exercises are the only way to strengthen the pelvic floor. They're important, but our pelvic floor should act as a part of our system, right? And it's part of our whole core. And when I say your core, I'm meaning pelvic floor here, your abdominal wall, your respiratory diaphragm, and even your low back, deep layer of your muscles. And so it's very important. A lot of what we work on is exactly what you were talking about, is the breath. And the connection of our breath to our pelvic floor muscles is really important. You're correct. Most of the time, when we inhale or take a breath in, our diaphragm descends. And so the pelvic floor reaction is to also come down or descend most of the time. Exhale, it kind of naturally lifts up a little bit. as the diaphragm comes back up. But some people, like yourself, may find it. So usually I'll have people try to do their pelvic floor activation when they're exhaling. But for some people, like yourself, it was easier to do with inhale. So it kind of does depend on your body and just your coordination, and like what works is whatever works for you. Honestly, we should be able to activate our pelvic floor, whether we're inhaling, exhaling,
Right.
lifting things, moving. It shouldn't matter really what we're doing. But when I see people in the context of you're trying to teach them how to coordinate their pelvic floor with the rest of their system, the breath is a way to help do that. And it's important that our pelvic floor works with the rest of the body. If you have really weak hips, if your abdominal wall is super weak, that's going to matter for what's going on down there at the pelvic floor. If you have no good core activation with a lot of your regular daily activities and your abdominal wall is super weak, that's going to put more pressure down on this pelvic floor, potentially causing prolapse and other issues. And so it's important that we can kind of look at the whole system and how does that work together. And also that we don't just teach people lay down on the bed and do pelvic floor exercises, right? Because most of us are not laying down most of our day. We have to actually look, what is the pelvic floor doing when you're standing up? Because that's when most people leak, or even going from sit to stand is a very common. You mentioned that earlier. People, as they're getting out of bed when they're older, rolling in bed or getting up from bed is a common when people leak because it's a change in pressure. But we would need to look like, what are they doing when they go from sit to stand or just standing? Because if you just look at someone laying down on a table, that's really not very functional. So it's also working the pelvic floor and the whole core system in more upright positions.
Yeah. Are we done with the myths?
I think I have one more. This is my
Okay.
last.
All right.
And then we can go with the
Yeah.
questions.
And then I want to open it up because
So
I do have a couple other things I want to talk to you about.
the last one is that only women have pelvic floor issues and urinary incontinence. And we mentioned this earlier, but I don't. This is a recent statistic that I saw is 1 in 6 men um, by age 75, if they're lived to 75, are diagnosed with prostate cancer. And so I don't think we can underestimate the number of men have prostate issues. And after prostate treatment, now it does matter whether it's surgery, radiation, or what it is, but somewhere between like 80% to 98% of men will have urinary incontinence after prostate cancer treatment. And 68 to 95% of men might have erectile dysfunction as well. So, that's the most common for me personally. I've seen men for pelvic pain, but as far as incontinence has been when they remove the prostate gland, as you see here. And of course, it depends on the extent of the cancer and all of that. But they can have urinary leakage after a procedure like that. But that is something that can be helped even with physical therapy, with strengthening and teaching them other things.
But is it the same types of techniques? I mean, you're still using your pelvic floor in various ways, right? You're still engaging with it, like maybe through the breath, maybe from front to back, from back to front, and still doing all these different strategies for cross, really getting your pelvic floor to engage in
Yes.
different
I
ways.
mean, it's very similar. Their anatomy is just different, right? Like so the strategies, the way I teach people how to activate their core with breath is very similar. The cues I give are different because they have different anatomy. And I find that men are very disconnected from because at least a lot of women have pregnant or given birth or certain things where you've tried to connect at times, and guys are like, huh, what? Oh, there's a thing that does that, like they just don't have that awareness. So that's really important. And honestly, it's not very standard here for men to have pelvic floor therapy going prior to prostate cancer surgery, but that would be the ideal because they learn some things. There's a therapist in Australia that's done some research on this, and that prehab and teaching them what to do so they can start immediately post surgery, but also they've got the connection before they even have the procedure
Yeah.
will really affect their long-term outcome.
Yeah, and I mean, for me, I had hip surgery and that's when this all started because it was like I got super disconnected and like, wow. But the therapy really helped me to kind of connect with my pelvic floor again. So, okay. The other thing that I want to talk about, which really segues well with what you were just saying, like the not really having that mind body connection, is that when we do this work, so when we start connecting with our pelvic floors and when we like, think about it and use our brains and open more neural pathways in our brains, what we know is that this also improves brain health. Right? So like, I mean, any of this interoception where we're connecting with our internal organs, like feeling your heart beating, connecting with your breath, engaging with your little pinky finger and your pinky toe, all of that has been shown as one of the 5 ways that we can prolong the progression of dementia. And, this disconnection with, your organs inside your body has also been shown to increase people's susceptibility to exploitation. And it's funny because this morning there was actually a CNN little snippet on CNN about Duke Kahn, who's a brain researcher out of USC, who was talking about, this really early indicator of Alzheimer's disease being people who are falling victims to scams. And he's the guy who kind of said, with our brain changes that we're seeing with dementia, whether it's vascular or Alzheimer's, what we know is that in the first 10 years of brain changes that are really often undetectable, that's when we see scams and exploitability. So like, doing this mind body connection, what we've learned in some of the other research, actually, when people are connected to their bodies, they are less susceptible to things like scams. And so, we can only assume that that's going to help with delaying progression. Well, we know from the science it delays the progression of dementia, but it may also, help us when we're in our 50s, 60s, 70s to maintain financial acuity, to continue to be able to manage your own affairs, to continue to be sharp, continue to, be able to, avoid this idea of aphasia, not being able to grasp words and those sorts of things. So like, there's so many benefits to this, so many benefits. But I think the number one benefit in my mind, just working with seniors and their families, is avoiding incontinence and, or limiting incontinence as much as that's available. But tell us, Mandy, when you do work one-on-one with clients, like what are some of and I hate to be too graphic about this, but how do you do that? I mean, are you having people like, are you testing their pelvic floors with them? So that is the work that you're doing, is that you're
Yeah,
actually,
when I first see someone, like the first appointment, if they're okay with it, obviously they have to give me permission. I mean, some people aren't comfortable with an internal exam the first time I see them, and that's fine. There's other things I can look at and do and figure out about their coordination. But typically, it would be an internal exam because I could look from the outside and try to look at what the coordination is happening. But unless I go inside, I can't really feel the strength of the muscles. And same with even the male population, it would be a digital rectal exam because that's their only outlet. But I would need to see, like, okay, what is their squeeze like? Like, I need to feel what is the strength? Am I getting that pull up and in, or is it just a little bit of squeeze? Am I not getting any of that excursion? It's difficult to tell from just looking, or if someone has their clothing on. It's hard to tell. Whereas if I'm feeling and then I'm looking at their glutes and like, okay, they're squeezing their bottom together, but there's nothing happening with the pelvic floor. I will basically evaluate that, and then we kind of go from there, depending on what they're doing well, what they're not. Like, maybe their abs are strong, but their pelvic floor is weak. So we can use their abdominals to help that. And in some functional positions, for example, one thing I do that I love is checking people standing and what happens when they put a weight in their hand. Like, most people, when they pick up like a 10 or 15-pound weight, it doesn't have to be heavy. Their pelvic floor responds to that because their pelvic floor is on to, react to that weight being put on them. So it's like, well, if that's the case for that person, weight training is a great way to also work on their pelvic, like with the system, right?
Yeah.
Balance is another huge one that further, I don't think we can undercount for our elderly population with falling, fractures, surgeries, all that, how important balance is. And it's interesting because I will give people even balance exercises to do if I feel when I have them do like some one-legged stance or some things while I'm testing their pelvic floor, that their pelvic floor turns on with that. I'll give them stuff like that to do. That's number one, functional, because we all need to work on balance. But number two, if that is activating their pelvic floor, just by doing a balance exercise, they don't even necessarily have to think about this connection piece. That's important.
Right.
But it's also like, how can they do it just with functional activities?
Yoga. They can do it with yoga.
Yoga is but again, you see
Yeah.
even some of your like they just don't necessarily yeah, I mean yoga is great because you're stretching, even some of the things I suggest to people whose pelvic floor is tight are basically yoga positions or stretches to open the area up. But there's still that piece that you talked about that's so important of the brain body connection. And it really takes one-on-one for that. There are some decent online programs. There's some not good ones too for people to strengthen their pelvic floor. But what you're not getting with that is the more personalized, like, what are you doing as an individual with your pelvic floor? Getting that feedback from a professional, if that makes sense.
And on that note, tell us a little bit about your business. And I know we have to kind of wrap it up. We're going to get the hook here in a second.
Yeah.
But tell us about the business model that you have in place and how people can reach to you.
Yes. So I am in private practice myself, and I'm located inside Sage Wellness in Hale Plantation Village Center. My email is Dr. Mandy, Mandy Roscow, Roscow @gmail.com. They can also go on if they're just interested in looking at my website. It's serenitypelvic.com. Um, my return clients can actually book through the website, but the first time I see someone, um, I will talk to them before they come in to set up their initial appointment. But if they're just interested, they can go on the website and fill out a contact me, that they're interested, and then I will follow up with them. And then the phone number is 352-249-5333. And I'm sorry, by the way, my voice has been a little, I'm fighting some like throat thing. So I'm sorry, I don't normally quite sound like this, but
Me either. I keep turning off the microphone to cough, so I'm with you completely. Um, let me just make sure I got this right. 352-249. I have too many threes in mine. It's 5333, but and May has it right, which is the bottom one.
yes.
All right, Mandy. Well, thank you so much for agreeing to speak to us about this. This is just exactly the kind of information that our clients are looking for, that people who aren't even looking for it really need. So we so appreciate you just sharing your expertise with us, and the way that you kind of explain things. It's just so effective. So thank you for sharing with us
You're
today.
welcome. Thanks for having me.
All right. Have a good one, guys.
Great day.
Thank you.